Hi, I'm Dr. Hootan Zandifar, and I'm a board-certified otolaryngologist, and I wanted to tell you a little bit about a procedure that's very common, a lot of people do it, called turbinate reduction. Now, you may have heard of it, you may have not, but it's a procedure that's usually combined with other nasal surgeries like a septoplasty or a rhinoplasty. Now, why? What is a turbinate reduction? So first we have to tell you what are turbinates. If we look inside our noses, there are these bulges on the side of the nose, on the sides internally, that are called nasal turbinates. Now we have three of them on each side. We have the lower ones, inferior. We have the middle ones, medial, which are called middle turbinate. We have the upper ones, which are called superior turbinates. For the purpose of turbinate reduction, we typically only talk about the lower ones, or the inferior nasal turbinates. When these turbinates swell up, which they typically do when you have a cold or a flu or an allergy, they cause nasal obstruction. You can't breathe. So typical symptoms would be you blow your nose, nothing comes out. You're stuffed up, but there's nothing that improves it. Turbinates can sometimes swell up on one side or the other. So you may sleep on this side swells up, then turn around, that side swells up. These are typical signs of turbinate enlargement. You can take medications like Sudafed to decrease them, allergy medications, but sometimes those don't work. Certain nasal sprays like Flonase or other over-the-counter or prescription nasal sprays can shrink them, but again, that's not something you may need to use regularly or you can use regularly. So if those are not the options for you, the best option is actually to shrink them surgically. There are various ways of shrinking the nasal turbinate surgically. However, collectively, they're all called turbinate reduction. We can use a shaver, we can cut them, we could use electric cautery to shrink them. All these methods depend on what your anatomy looks like and what your surgeon is comfortable with, but generally, most of them are very successful with minimal risk. So, if you're suffering from nasal obstruction, you don't know what to do about it, give us a call. We'd be more than happy to help you with that.